Did you know that some vitamins have the incredible power to keep your heart beating strong and protected from attacks? What if I told you that the secret to avoiding a stroke could be on your plate? Let's find out together what these miracle vitamins are and how you can use them to your advantage. Like and subscribe to our channel. Each like and subscription helps us bring you more quality health content. Your participation makes the difference. Vitamins are essential components in maintaining cardiovascular health, acting on several biological mechanisms that support the optimal functioning of the heart and blood vessels. Each vitamin plays a specific role, whether it's reducing inflammation, strengthening arterial walls, or preventing the buildup of cholesterol deposits that can lead to serious conditions like heart attacks and strokes. The importance of a diet rich in specific vitamins cannot be underestimated, as these nutrients are crucial in fighting oxidative stress and promoting endothelial health, which is vital for maintaining healthy, flexible blood vessels. In addition to their protective functions, some vitamins have a direct role in regulating blood pressure and blood clotting, essential processes for preventing adverse cardiovascular conditions. For example, vitamin D is known to help regulate calcium and phosphorus levels in the blood, influencing blood pressure and heart function. Likewise, vitamin K is essential in the synthesis of proteins involved in blood clotting, which is crucial for preventing excessive bleeding, while also helping to prevent calcification of the arteries. Therefore, understanding and properly incorporating these vitamins into your daily diet can provide a strong line of defense against many of the common threats to cardiovascular health. Vitamin A. Vitamin A plays a crucial role in maintaining the health of blood vessels, acting as a guardian against the development of cardiovascular diseases, especially atherosclerosis. This vitamin is essential for the production of endothelial cells, which form the inner layer of blood vessels. By promoting the integrity of this lining, vitamin A helps prevent the formation of arterial plaque, a major contributor to atherosclerosis. Additionally, it has antioxidant properties that protect endothelial cells against oxidative damage, a known risk factor for hardening of the arteries. In addition to its direct protective effects on endothelial cells, vitamin A also influences immune function, which is vital in modulating the inflammatory response associated with the progression of atherosclerosis. Studies indicate that adequate levels of vitamin A can reduce chronic inflammation in blood vessels, thus decreasing the risk of injuries that can accelerate plaque buildup. This ability to control inflammation and protect against oxidative stress makes vitamin A an essential component in the diet of those looking to keep their arteries healthy and free from heart-damaging blockages. Vitamin C. Vitamin C is widely recognized for its potent antioxidant capacity, which is critical in preventing oxidative damage to the body's cells, including heart and blood vessel cells. This water-soluble antioxidant helps neutralize free radicals, unstable molecules that can damage cells and contribute to the development of cardiovascular diseases such as atherosclerosis and hypertension. By protecting cells against this damage, vitamin C helps maintain the integrity and functionality of arteries and veins, preventing the accumulation of cholesterol plaques and vascular deterioration that can lead to serious cardiac events. In addition to its antioxidant properties, vitamin C also plays a vital role in the synthesis of collagen, a protein essential for blood vessel health. Collagen helps maintain the elasticity and strength of vessels, allowing them to better withstand fluctuations in blood pressure and reducing the risk of ruptures and other vascular complications. Therefore, maintaining adequate levels of vitamin C through diet or supplementation can be an effective strategy to strengthen cardiovascular health and minimize the risk of heart-related diseases. Vitamin D. Vitamin D, often called the sunshine vitamin due to its production in the skin under sun exposure, plays a fundamental role in cardiovascular health, especially in regulating blood pressure. Research indicates that vitamin D can directly influence blood pressure levels through its effect on calcium metabolism and blood vessel function. It facilitates the absorption of calcium and phosphorus in the body, which are essential for maintaining muscle and vascular health. Additionally, vitamin D modulates renin, an enzyme produced by the kidneys that influences blood pressure. Adequate vitamin D levels help keep renin in balance, preventing blood pressure fluctuations that can lead to serious heart complications. In addition to its direct impact on blood pressure, vitamin D also contributes to cardiovascular health by minimizing the risk of diabetes and metabolic syndrome, both known risk factors for heart disease. Studies have shown that low levels of vitamin D are associated with an increased risk of type 2 diabetes and insulin resistance, conditions that can harm cardiovascular health. Maintaining adequate levels of vitamin D, whether through sun exposure, diet, or supplementation, is essential to promote healthy heart function and prevent the progression of cardiovascular disease. Vitamin E. Vitamin E is a powerful fat-soluble antioxidant that plays a crucial role in protecting blood cells and vessel walls against oxidative damage. It helps fight free radicals, which are reactive chemical compounds that can damage cells, proteins, and DNA, contributing to the development of cardiovascular diseases, such as atherosclerosis. By neutralizing these free radicals, vitamin E maintains the integrity of blood cells, including the cells that make up the vascular endothelium, the inner layer of blood vessels. This protection is vital to prevent the hardening and narrowing of arteries that can lead to conditions such as heart attacks and strokes. Additionally, vitamin E helps to inhibit the oxidation of LDL cholesterol, the bad cholesterol, a process that is fundamental in the formation of atherosclerotic plaques in arterial walls. When LDL is oxidized, it becomes more adherent to the walls of blood vessels, forming plaques that can obstruct blood flow and increase the risk of cardiovascular events. Supplementing or consuming foods rich in vitamin E may therefore offer an additional layer of protection against these pathological processes, contributing significantly to long-term cardiovascular health. B-complex vitamins. B-complex vitamins, especially B6, B12, and folate, play a crucial role in reducing blood levels of homocysteine, an amino acid that in high concentrations is associated with an increased risk of cardiovascular disease. Homocysteine is naturally produced in the body during protein metabolism, and its levels can be influenced by genetic and nutritional factors. Vitamins B6, B12, and folate help convert homocysteine into other benign substances, maintaining healthy levels and minimizing its harmful impact on blood vessel walls. Elevated homocysteine levels are known to contribute to the hardening and loss of elasticity of arteries, thus increasing the risk of atherosclerosis and other cardiovascular complications. The importance of maintaining adequate levels of these B vitamins is reinforced by several studies that correlate deficiencies in these nutrients with an increase in the concentration of homocysteine in the blood. Supplementation or adequate consumption of foods rich in B6, B12, and folate, such as whole grains, legumes, meat, and dairy products, may therefore be an effective strategy for reducing the risk of heart disease. Furthermore, these vitamins support general energy metabolism and nerve function, providing benefits that go beyond cardiovascular health to the body's overall well-being. Vitamin K. Vitamin K is essential for cardiovascular health, playing a crucial role in blood clotting and preventing calcifications in the arteries. This vitamin acts as an essential cofactor for the synthesis of proteins that regulate clotting, helping to maintain the balance between preventing excessive bleeding and the formation of dangerous clots. Additionally, vitamin K is vital for activating proteins that control calcium deposits in tissues, including arteries. Without an adequate amount of vitamin K, there is an increased risk of vascular calcification, where calcium deposits on artery walls, potentially leading to atherosclerosis, which can obstruct blood flow and increase the risk of heart attacks and strokes. In addition to its role in clotting and arterial health, vitamin K also shows benefits in maintaining bone health and preventing osteoporosis. It facilitates the incorporation of calcium into the bones, strengthening the skeleton, while preventing this calcium from accumulating unduly in the arteries, thus guaranteeing a double protective function. To maximize these benefits, adequate vitamin K intake can be achieved through a diet rich in green leafy vegetables, such as kale, spinach, and broccoli, as well as other foods such as meat and dairy. Maintaining adequate levels of this vitamin is crucial for cardiovascular protection and the body's general health. Magnesium and potassium. Magnesium and potassium are crucial for heart health, enhancing vitamin actions to optimize cardiac and vascular functions. Magnesium, essential for over 300 biochemical reactions, helps produce ATP, the primary cellular energy molecule. It also helps regulate potassium and calcium levels within cells, which are important for the normal conduction of electrical impulses in the heart. This balance is essential to maintain a regular heart rhythm and to avoid arrhythmias. Additionally, magnesium has a relaxing effect on blood vessels, which can help reduce blood pressure and vascular resistance, thus minimizing the risk of hypertension and other cardiovascular complications. In turn, potassium is essential for maintaining the normal electrical function of the heart, helping to regulate blood pressure and fluid balance in the body. An adequate intake of potassium can counterbalance the effects of sodium, helping to maintain healthy blood pressure. Studies have shown that diets rich in potassium are associated with a reduced risk of stroke and may be beneficial in preventing heart disease. The combination of magnesium and potassium, therefore, not only complements the action of the vitamins in supporting cardiovascular health, but also offers its own unique benefits that are fundamental to keeping the heart and blood vessels healthy and functioning optimally. Food sources of cardioprotective vitamins. Incorporating cardioprotective vitamins into the diet is an effective strategy for improving heart health and preventing cardiovascular disease. For vitamin A, rich foods include liver, carrots, sweet potatoes, spinach, and kale, which are also excellent sources of beta-carotene, a precursor to vitamin A. Vitamin C can be found abundantly in citrus fruits like oranges and lemons, as well as peppers, strawberries, kiwi, and broccoli. Vitamin D is a little more challenging to obtain through food alone, but fatty fish like salmon, mackerel, and sardines, as well as fortified milk and eggs, are good sources. Vitamin E is present in nuts, seeds, spinach, and avocado. For B vitamins, especially B6, B12, and folate, focusing on foods like lean meats, fish, eggs, dairy, legumes, and green leafy vegetables is essential. In addition to vitamins, it is important not to forget minerals such as magnesium and potassium, which play crucial roles in maintaining cardiovascular health. Good sources of magnesium include whole grains, nuts, seeds, legumes, and dark leafy greens. Potassium can be found in abundance in bananas, potatoes, tomatoes, oranges, and green leafy vegetables. Incorporating a variety of these foods into your diet not only provides a rich source of cardioprotective nutrients, but also helps you maintain a balanced and diverse diet, which is key to robust overall health. This holistic approach ensures you get the maximum benefits of these essential nutrients. Vitamin supplementation. Vitamin supplementation may be necessary in certain situations where the diet is not sufficient to meet nutritional needs or when specific medical conditions require an increased intake of certain nutrients. For example, individuals who have limited access to a variety of fresh foods, those who follow strict diets such as vegans, or people with significant food allergies may require supplements to prevent nutritional deficiencies. Likewise, older people or those with conditions that affect nutrient absorption in the intestine, such as celiac disease or inflammatory bowel disease, may also benefit from supplementation. It is crucial, however, to consult a healthcare professional before beginning any supplement regimen to assess individual needs and avoid toxicity, especially in the case of fat-soluble vitamins such as A, D, E, and K, which can accumulate in the body. In the cardiovascular context, supplementation can be recommended for individuals at risk of heart disease or who already have related conditions. For example, supplementation of B vitamins, particularly folate and vitamins B6 and B12, may be advised to reduce homocysteine levels, a known risk factor for heart disease. Vitamin D can be supplemented in people with low exposure to sunlight to help regulate blood pressure and cardiovascular function. However, it is essential that such supplements are carried out under medical supervision to ensure that the doses are adequate and to monitor the response to treatment, avoiding adverse effects or drug interactions. Additionally, when considering supplementation, it is important to focus on supplement quality and choose products that are certified by trusted organizations that test products for purity and potency. Education about reading labels and understanding recommended doses is essential, as is being aware that supplements should not replace a balanced diet. They are intended to complement the diet, providing nutrients that may be missing. Maintaining open communication with healthcare professionals allows for effective supplementation planning, which should be adjusted according to changes in the individual's health and lifestyle over time. Healthy lifestyles. Adopting a healthy lifestyle is key to maximizing the benefits of vitamins in preventing heart disease. In addition to a diet rich in essential vitamins and minerals, regular physical activity is one of the pillars of a heart-healthy lifestyle. Physical exercise helps improve blood circulation, reduce blood pressure, increase HDL, good cholesterol levels, and lower LDL, bad cholesterol levels. Additionally, regular exercise can help control your weight and reduce your risk of developing type 2 diabetes, another significant risk factor for heart disease. Combining adequate nutrition with regular exercise creates a synergistic effect that enhances the cardiovascular protection offered by vitamins and other nutrients. Managing stress is also a crucial aspect of a healthy lifestyle that complements the effects of vitamins on heart health. Chronic stress can lead to unhealthy behaviors, such as unbalanced diet, physical inactivity, and smoking, which are known risk factors for the development of cardiovascular diseases. Stress reduction techniques, such as meditation, yoga, or even relaxing hobbies, can help mitigate the negative effects of stress by promoting a healthier balance in the body and improving the effectiveness of vitamins and other nutrients in maintaining cardiovascular health. Finally, it is essential not to neglect the importance of sleep for heart health. Sleep deprivation has been linked to an increased risk of high blood pressure, obesity, and diabetes, all of which are risk factors for heart disease. Adequate sleep helps regulate stress hormones, improves metabolism regulation, and gives the body a chance to recover and repair tissues, including those in the cardiovascular system. Therefore, ensuring an adequate amount of quality sleep is another vital aspect that works together with good nutrition and healthy lifestyle habits to strengthen the heart and prolong life. While vitamin supplementation is beneficial in many cases, it is crucial to be aware of the potential risks and drug interactions that may arise. One of the main risks associated with vitamin supplementation involves hypervitaminosis, which is the excessive consumption of fat-soluble vitamins such as vitamins A, D, E, and K. These vitamins are stored in the body and, when ingested in excessive amounts, can lead to toxicity and related health problems such as liver and kidney damage, bone disorders, and, in the case of vitamin A, potential teratogenicity that can affect fetal development. Therefore, it is vital to monitor your intake of these vitamins and follow established daily recommendations to avoid adverse effects. Additionally, vitamins can interact with prescription medications, affecting the effectiveness of both. For example, vitamin K can reduce the effectiveness of blood thinners like warfarin, potentially leading to an increased risk of blood clots. Vitamin E, when taken in high doses, may increase the risk of bleeding in people taking blood thinners or antiplatelet drugs. It is also important to consider that B vitamin supplements, especially B6, can interfere with certain anticonvulsant medications, altering their effectiveness. Therefore, before beginning any supplement regimen, it is essential to consult a healthcare professional to discuss any medications currently being used and evaluate possible interactions. Finally, the safest approach is to obtain vitamins and minerals mainly through diet, using supplements only when necessary and under medical guidance. This helps ensure that all nutrients work in harmony as part of a balanced diet and minimizes the risks of drug interactions and nutritional excesses. Healthcare professionals can offer personalized advice based on individual health needs, existing conditions, and prescribed medications, ensuring safe and effective supplementation when needed. Consciously integrating vitamins into the daily diet is a fundamental step towards preventing heart disease and stroke. Through a balanced diet rich in essential nutrients, it is possible to strengthen the cardiovascular system and minimize the risks associated with these conditions. Vitamins play specific and crucial roles, such as maintaining the integrity of blood vessels, reducing inflammation, regulating blood pressure, and preventing clot formation. Therefore, ensuring adequate vitamin intake not only contributes to heart health, but also promotes an overall improvement in quality of life and well-being. In addition to focusing on vitamin intake, it is important to consider a holistic approach to cardiovascular health, which includes maintaining an active lifestyle, managing stress effectively, and ensuring quality sleep. These elements, combined with a vitamin-rich diet, offer robust protection against heart disease and stroke. Cardiovascular health does not just depend on an isolated factor, but rather on a series of daily choices that, together, create an internal environment conducive to maintaining a healthy heart and preventing disease. Finally, while supplementation may be useful in specific cases where diet is not sufficient or when medical conditions require it, it is essential to do so under medical guidance to avoid risks of toxicity or drug interactions. Proper nutrition, along with a healthy lifestyle, is the best way to utilize vitamins to support cardiovascular health. Therefore, consciously integrating these nutrients into the daily diet is crucial to preventing heart disease and stroke, reinforcing the importance of informed and responsible food choices in the context of comprehensive and lasting health. So, are you ready to make a real change in your health? Remember, every little step counts. Don't forget to like this video, subscribe to the channel for more health tips, and activate the bell so you don't miss any news. And now, I want to hear from you. Which vitamin do you think you need most in your diet? Share in the comments and let's continue this conversation. Turn knowledge into action and see the difference in your life.